The North Central Accountable Community of Health is an organization composed of people involved in different healthcare and social organizations around the North Central Washington area. NCACH gets these people together to talk about and work on projects to improve the health of the people in this region.
So the value for the communities in North Central Washington is that we're primary rural, right? And so we have a lot of organizations that care and are passionate about the community, but they don't necessarily have all the resources. This is where NCACH brings us all together at one table, where we can share those resources to make a bigger impact to the community.
What is one of the biggest impact that the organization has, the significant impact that this organization has done in these 40 years, I would say would be the creation and the growth of the community health improvement, the CHI organization. Each county has a CHI, a group that meets monthly, and the members of the CHI are once again community leaders, elected officials, stakeholders, private organizations, nonprofit organizations, healthcare providers who comes in together to identify the needs of our community as far as healthcare and well-being and equity is concerned.
Part of what this is moving towards is getting health systems beyond the traditional narrow scope of practice of primary care by really looking at the whole person and addressing social determinants of health and really transforming how we deliver care in ways that we are going to be paid more by outcomes than just encounters, for example. So this is a huge deal in terms of facilitating systemic change in healthcare that can address quality, first of all, for patients, but also cost efficiencies so that we can reduce the cost of care and still make the healthcare systems viable.
Well, it helps me understand what's out there. As a senator, when I'm in Olympia talking about funding for programs, I am actually, through NCACH, able to speak with people who are making these programs work. The boots on the ground type of situation. So if I have a question about certain funding that will be going through our budgets or certain projects that are being discussed, I can go to the NCACH staff and other members to get those answers.
The impact they have in our community here locally, I think it's great, and it's probably something we just can't even measure because I mean, I've seen everything from they've provided resources and support, grants to local organizations, and again through the CHIs they've managed to bring stakeholders and organizations to the same table. And I think it's pretty common for organizations and agencies to work in silos and get so caught up in the day-to-day work that when we're at the same table and we come together, we're truly forced to kind of identify gaps within our organizations and find ways to fill in those gaps and work together to achieve the overall, well-being of the whole person and achieve, stronger and healthier communities.
The impact of the organization has so much potential here in our region. Because it's a collective impact, bringing community partners together around the common theme of health and well-being for all. The impact has a lot of potential for really improving health outcomes in this region.
One of the biggest impacts from NCACH is simply getting together all the different people from this region to talk about ways they can work together better to improve the health of people in this region.
So I think the greatest value of the ACH is our role in connecting people, facilitating meetings, convening. We have a lot of contacts. We are a trusted, neutral entity. One of the things with the COVID going on, the state of Washington received from the federal government PPE, personal protection equipment. As you know, that includes masks, gloves, things like that. The Healthcare Authority reached out to the 9 ACH executive directors and said, we need help. Can you distribute these? In 2 weeks, 2 or 3 weeks, 4.5 million either masks or other forms of personal protection equipment were distributed all across the state. Now that couldn't have happened without 9 ACHs being in existence.
One of the most recent successes I've had personally with the ACH is that I, coming in as a new executive director into Grant County, they've advocated for our services to be able to improve across Grant County. They've created ways for me to be able to connect with the CEOs and directors of each of our community behavioral health agencies as well as our community medical centers so that we can begin to collaborate and to strengthen our partnerships. That's been a success for us. That's really helped strengthen the partnerships that we've had in the community. It's allowed us to take a look at referral sources, our crisis system, and they have advocated for us to open the doors to a beautiful new residential treatment facility.